I thought the surviving sepsis guidelines wanted us to give fluids, not take fluids away. Why is there an active fluid removal section in the new SCCM guidelines? What's up, you guys? It's your ER pharmacist, Lil Pharma. Today, we are continuing our mini-series on the SCCM guidelines, where I read through the guidelines and present them to you with my opinion so that you don't have to read the whole guideline. So today, we're talking about the active fluid removal recommendation from the SCCM. So their recommendation is for adults with septic shock, after the acute resuscitation phase, we suggest using active fluid removal. So conditional recommendation, very low certainty of evidence. So yes, in the initial stages of resuscitation, patients usually do need fluid. Whether that's 30 mils per kilo or not will be a topic for a different day, but we are going to need to give them fluids to some extent early on in their shock state. Then once they are stable and resuscitated, we know that fluid overload can cause harm. So a lot of times we accidentally give our patients a little bit too much fluid. We push it past the point of where they're actually fluid responsive. And so we have to take that fluid away or else we'll cause other problems like peripheral edema, pulmonary edema, venous congestion. We can see organ dysfunction, decreased perfusion, all of those types of things. So any type of organ dysfunction can be due to fluid overload. So we do need to get that fluid off of the patient. So how do we do this? Typically, we'll start with a loop diuretic like Lasix or furosemide. If that's not effective, then we can move on to something like ultrafiltration or renal replacement therapy, dialysis, to get that fluid off the patient. So what does the data show? Unfortunately, there is no clear big RCT that shows, yes, absolutely, we should do this exact way. But there is a trend towards improved mortality with diuretics and potentially ultrafiltration. But we don't have any clear data saying that, yes, this is going to decrease your ICU stay. Yes, this is going to decrease your mortality. We just know that bad things happen when we give too much fluid. So your patient's unstable in septic shock, resuscitate, stabilize, and then de-resuscitate. So kind of confusing because you're giving fluids up front and then you want to take them away after the fact. But we know that sepsis patients really need that volume in the initial stages. And then after the fact, when we potentially over-resuscitated them a little bit, we need to take some of that away for better outcomes. All right, that's what I got for you guys. I think that's probably the end of the SCCM series for medication updates. Obviously, there were a lot of other updates that we did not cover, but as far as the medications go, I think we did a pretty good job of covering the new updates. So thanks for sticking around. Bye.